Welcome back to the Hand to Shoulder Solution, giving pain the middle finger. I'm your host, Carl Petito. I'm an occupational therapist and a board-certified hand therapist. I specialize in rehab of any orthopedic condition affecting the fingertips through the shoulder. So today, let's talk about pain on the thumb side of the wrist. Thumb tendonitis. This is a very common thing. We use our thumbs for everything. And time is of the essence with everything, but especially with the thumb tendonitis, because this quickly, easily leads to needing hand surgery. As a hand therapist, I want to help you avoid the need for hand surgery. So the sooner we can get to this, the better. You can see on my thumb with the tendons that are involved, they pick up. So, these are used a lot. And they are held down against the bone right here by a thick, heavy ligament, and that is a friction point. Also here, if you feel you follow the base of your thumb down, and then there's the bony knob, you can feel that area. If that's tender, that's called radiostyloiditis. Itis means inflammation, but this inflamed area of bone, and there's also a little fluid sac there that gets inflamed and aggravated with this condition. So these very often both occur at the same time. So let's talk about these tendons. There's two tendons that lift the thumb up. One is this one, extensor pollicis longus, and that travels down around here. That is not involved in this, okay? Now, extensor pollicis brevis, if you bend the tip down and you push up here, that's the tendon right there. That is one of them that is involved in this. So if you bend the tip down and you put your opposite finger just below that knuckle and push up, and that hurts a lot right there, that means that you have tendonitis right there. Okay, now, abductor pollicis longus, that does this. That tendon goes right here, and that's over here. So if you resist that, if you pull your thumb away from your palm a little bit, and now you resist that motion, and that hurts down here, that's a big one. The main one is the test called Finkelstein's maneuver, where I have the patient hold their thumb, and then you bend it down toward your little finger, and if that hurts a lot right there, that is a positive test for the thumb tendonitis. It's called Quervain's tenosynovitis. All right? So it's a combination of how's this for alphabet soup? Quervain's tenosynovitis and radiostyloiditis. Isn't that a fun one? So when you do those tests and that's bothering you, you have to get in, be seen by your healthcare provider immediately. There's a lot of things we can do. The sooner I see you, the better more effectively I can save you from needing surgery. So what do we do for this? I will fabricate, I made this on myself. So I fabricate a custom orthosis that goes over the thumb. The tip of the thumb is free because that muscle tendon is not involved. You can still use your fingertips. You can grab things and read a book and fold clothes and still use your hand. And after this starts feeling better, after a patient wears this for some time, I can cut off the forearm piece to free the wrist. And I'll just give you an example on a different splint. Another custom splint. These are called a thumb spica. So now the wrist is free. These are held on by Velcro straps. I just removed the straps. So now your wrist is free to move, but it's still securing those tendons and allowing those to rest. So that's a good step down. And then finally, we fully get rid of the splints. In the meantime, we're also doing ultrasound. We're doing some light stretches, home program, educating you to specific stretches to do to help your specific situation. Also, proper timing and technique of heat versus cold. And also in the clinic we're using the cold laser, et cetera, and some soft tissue techniques where I would pull the skin up a little bit to loosen any adhesions or stuck areas, or very slightly stretch the skin on the surface, but not aggravate the underlying structures. So there's a lot of tools in the toolbox. Studies have also shown that if you're agreeable to getting a steroid injection, the little bit of steroid right there will also really nip it in the bud and be another great tool to just getting rid of that tendonitis. The surgery is to go under the skin and cut that strap of material that is grinding on the tendon, that the tendon is sliding on, that's compressing it. And then there's also sheaths around the tendon material. Here's another item here. and the tendon, you can see the blue area, the tendon is wrapped in a sheath, and between the sheath and the tendon is some lubricating fluid. So, you know, it gets complex, and that sometimes that gets a bunch of scar tissue, especially if this has been going on for a long time, and you know, if it's been going on for a year or so, you're most likely just going to end up needing the surgery. And the surgery is a relatively basic surgery, and the surgeon goes in there and cleans up the scar tissue. They release those structures I just talked about, so now there's no pressure on the tendon. But if you just started having this condition, you can get in to me and be seen by your hand therapist sooner rather than later. That's the key. Thanks a lot for watching. Thanks for sharing the video. Write in with any questions. Share your experiences. I want to get people talking about this. It's as common as carpal tunnel syndrome. So many people have this. It has to be taken care of sooner rather than later.